Hi guys, Ryan Mullen here from Advanced Physical and Aquatic Therapy, hashtag Advance Your Health Video Project. Today we have a question for Ask the PT Friday, and it is coming from Jen. She's having some pain with overhead holding onto a bar when she comes down out of the kip for like a kipping toes to bar, where you hold onto a bar and bring your toes up, or when you're doing a pull-up and you come back down. So we're causing some pain right here in the anterior shoulder, which might be a little bit of rotator cuff impingement and some pain in the posterior shoulder after these exercises. So to fix that, we have 4 activities we're going to do. 2 of them being mobilizing in that position of restriction overhead, and then we're going to strengthen the muscles that we feel are weak, causing that instability when she bottoms out. So I got Lucas here. He's one of our students here at Advance. He's going to demonstrate for us the activities we're going to do. First, we're going to lie down on a foam roller, and it's going to be right in our thoracic spine, which is just right about the top of your low back, and it stops right here when you bend your neck down. You feel a bone pop out, that's where it's going to stop. So you want to try to address every level of that all the way down. You can lie down, Lucas, on that, and we're going to give him a PVC pipe to hold overhead, the same grip that he would take if he were to hold on to the bar and do that kipping overhead motion. So whatever his grip is comfortable, a little bit of a wider grip because he's got a little bigger guy, he's got wider shoulders. He's going to hold it in that grip and then go overhead. So key here is he's overextending a little bit in his lumbar spine. We want him to keep his belly tight and try to flatten that out. And we're just trying to extend at his thoracic spine. So he's going to spend about 10 reps trying to bring that bar overhead a little bit more at that level, and then he's going to roll down a little bit. So can you roll down a little bit for us, Lucas? Get a little higher up on that thoracic spine. And then he's going to do another 10 reps while keeping his stomach tight, not trying to arch his back too much. So we got 10 reps there, every level. Should take about 3 to 4 minutes to do this, okay? So if you just spend a minute or 2 on it, that's not enough time under tension. You need to get a little more therapeutic time in there. All right, can we hop up here, Lucas? We're going to move the camera over here. And can we head on over to the bands? All right, so now we are going to do a mobilization for that overhead movement. We're trying to bring that joint capsule back and down, so that's what the band is doing. So it's pulling back and down on Lucas's shoulder. He's going to take this and put his hand right on the top that he's going to mobilize, and then this hand's going to drive that arm up over his head. And he's going to try to find that end range right there. He's going to hold it for a few seconds to come back out of it. We're going to get 30 reps like that. The other way you can replicate this is you can pull that band on a rack and just grab onto, if you can grab onto the bar, that's great. Maybe get a little box. Or you can just hold on to the rack itself. But you want this arm to be as passive as possible for us to mobilize that humerus in the socket of your ball and socket of your shoulder. So he's getting 30 reps tallied up on that. And now we're going to move on to the strengthening aspect. Try to shore up that posterior musculature and get it stronger for the overhead motion. So first, we're going to grab that green band. If Lucas can grab the green band. And he's going to step back with a little tension. He's going to use both hands, and he's going to do a face pull, squeezing the shoulder blades together. So do a face pull, Lucas. And then he's going to externally rotate and engage that rotator cuff. And then he's going to come back down eccentrically and then slowly back. So there, he's going to do 30 reps, nice and slow. He's only going to do 5 for time's sake now, but I think you guys get the idea. And then last but not least, we're going to strengthen that posterior musculature of the shoulder with we can do both bands, I think, Lucas. And we're just going to do a Y, which is basically his arms are straight and he's just slightly overhead. We see that Y. His thumbs are heading back behind him. And he's again getting that shoulder blade squeeze back and down. Perfect. So we're going to get 30 of those. And then if we can move on to the T's, which is now he's going to come down to a horizontal plane. Perfectly straight back, squeeze the shoulder blades together, not letting his shoulder dump forward in the socket. And then last but not least, he's going to come down just another 45 degrees, and he's going to go back again. Thumbs behind him. This one's a little tougher, keeping them shoulder blades squeezed. 30 times. All right. that's it. Hopefully that helps. If you guys are finding these videos helpful, please like and share our page on Facebook. Thanks to Lucas for being our patient, and I will see you guys next time with your questions.